I am going to talk about alternatives to health insurance that are actually about making healthcare both affordable and accessible. And joining me now is Travis is like a multiple time guest. He's practically a co-host. Travis Bockenstedt is the Chief Experience Officer for Pinnacle Advanced Primary Care. They do direct primary care. And if you don't know what this is, hang in. We're going to help you understand the whole process. And joining her today is a new Travis Bockenstedt guest. Travis books all the guests now when it comes to healthcare. Lisa Fagan is the CEO of Smith Medical Direct Specialty Care. And this piece of the puzzle answers the question, what if I need a knee replacement? But we're going to start with Travis first. Travis, for my listeners who have never heard you on the show before, let's do the elevator speech. What is direct primary care?
So Pinnacle Advanced Primary Care and the DPC movement, think about it like the Netflix of healthcare. You are going to pay a fixed monthly membership fee for unlimited access to primary care and family medicine with no co-pays, deductibles, or office visit fees. So I want you to think about direct primary care like family medicine used to be 40, 50 years ago before insurance ruined all of it. And DPC can take care of 90% of a member's everyday health and wellness needs. But for your listeners, and Mandy, what we talk about a lot of times is, well, what happens outside of the direct primary care space? And it's really exciting in the marketplace right now that we're not only seeing the growth of direct primary care, there's a new strong movement called the direct specialty care movement. And Pinnacle's been very excited to partner up with our friends at Smith Medical because they're solving that problem in the market and actually making big procedures affordable for people.
So if you guys have listened to the show at all, I have been talking since I got a show in 2005 about the Oklahoma City Surgical Center. The Oklahoma City Surgical Center is a surgical center staffed by fine surgeons and doctors. And if you need a knee replacement, you can go right now to their website, Oklahoma City Surgical Center, and you can find out how much a knee replacement is going to cost because they publish all of their prices online. And I have held it up as the gold standard since 2005. And now we have one in our neighborhood, and it is called Smith Medical Direct Specialty Care. And on their website, I am right now clicking over to the page that says surgery pricing. So let's bring in CEO Lisa Fagan to talk about that aspect of it. Now, Lisa, I asked you why you called it Smith Medical Direct Specialty Care. It's actually named in honor of the doctor from the Oklahoma City Surgical Center. So there's a long introduction, but I wanted to get all that in to kind of give the background. So you guys are just doing the same thing.
Absolutely, yes. We named our company after Keith Smith because he's the pioneer, and we were honored that he allowed us to name our company after him. So we are a cash pay option for your surgical needs. We're affordable, transparent, bundled pricing. We're multi-specialty, so we can cover anything from a total joint to a spine to a hernia. And everything, all of our pricing is right online, like McDonald's. You take a look on our website and you can scroll through and you see a rotator cuff repair, you see a total joint, and there are no hidden fees. You know the exact price up front. Prior to surgery, you'll never get a bill on the back end. And our patients are loving it.
Well, and you know, it's funny because you look at some of these prices and some of them are high prices. I mean, you're talking about $22,000 for a total knee replacement. But when you get into the cost of health insurance for someone over the age of 50, they're paying that much in annual premiums for coverage that doesn't give them a whole bunch more. You know what I mean? It's like you have to break it down into how you actually use healthcare. Now, I want to ask Travis a question because the number one question I get is, so I sign up for direct primary care, or maybe even I sign up my business to take care of my employees with direct primary care. What happens if I have some kind of catastrophic event? You guys recommend these MediShare programs, or you work with some of those, but now you also have, you know, Smith Medical, where you can say, look, you can go over here. And Lisa, I'm assuming you have some kind of financing options.
We do have a financing option, but for employers, they actually love to pay direct too because they save a significant amount of money on like their premiums for insurance. So they save about 40 to to 60% if they go directly to companies like us. So a total knee, like you said, yeah, it's a big price, but it's a lot more affordable than if they go to a hospital or another surgery center, and they know exactly what they're going to pay. A total knee is the same price every single time they do it. Unlike when you go to a hospital, it could be a bunch of different prices. It can range anywhere from 300% for the same exact CPT code.
So there's everything, including plastic surgery, by the way. I was like, wait, what? I love that. And I think that eventually, and I'm hoping this kind of model catches on, that this is going to create some downward pressure on these prices in our metro area, because years ago when I interviewed Dr. Keith Smith on about this, he said, look, we've really seen some price reductions even in the hospitals because they have to compete with us. Now, you guys haven't been around that long, but how did you decide on this pricing? Like, tell me how you, and I don't need like a, bullet pointed every single aspect, but when you're setting pricing, what do you look at?
Well, we're really going off of Medicare pricing. So we're doing about 150% of what Medicare charges, and that's for across the board. So physician, anesthesia, facility, and then we don't up price the implant, which most places do. They charge like a 10% increase from the implant. We give it to them at cost. So really, we're just wanting to be affordable for these patients.
And that's another thing, Travis, about direct primary care, is that you go in, you get your office visits, they don't cost you anything extra. But say you need a blood test, say you need a strep test, say you need something along those lines. You guys will do the test, but you only charge wholesale pricing. And those price differences are shocking. Like what you will pay less paying for the test than a lot of us pay in a copay to go to a doctor's office.
Right. What you're finding here is we all follow the same principle. We believe that you can get high quality care at a very affordable price. And if we start to lift the veil on the madness that is happening behind the scenes, we can create stronger healthcare consumers. If you're someone that owns a business right now, and what's super exciting in the market is that Pinnacle now has our own health plan overlaid on top of our practice. And we are partnering specifically with Smith to refer surgeries over to them, because we know those who take our health plan, we will be saving them hundreds and thousands of dollars by doing a direct pay relationship with Smith Medical. So it's like two peas in a pod, right? We're keeping them happy and healthy. But when we want our members to get really affordable surgical care with no surprise medical bills, we are perfectly aligned with Smith, and we have the opportunity to save local employers and their employees hundreds of thousands of dollars.
I got a couple text messages earlier, Travis, from one of them from a guy who said, look, I run a business out of DIA and I've got 40 employees and I need to do something just to keep employees. And I was like, well, you're going to want to listen to this interview and give them a call. Now, Lisa, people don't have to have a membership with you, though, because I may only need Smith Medical Direct one time. Maybe if I go to get I'm not getting my nose done. I have a good nose, but you know what I mean. So I don't have to have a membership with you guys?
No membership. And the average person has a surgery every 14 years.
Right.
So, hopefully you don't see us all that often, but when you do need us, we're here, and it's affordable and transparent pricing.
So there's so many questions. What's the warranty on a knee replacement or any surgery? Do you get like 5,000 miles on that knee replacement? How does that even work?
So we don't have warranties on knee replacements. However, we stand by our work. So if you get an infection here from our surgery center, we will take care of it for free. We won't make you pay if you need to come in for a washout, or if you get a hematoma or something like that, a small complication, we'll take care of you for free. And but if your knee, you're rejecting your knee implant, then unfortunately, yes, you would have to have another surgery. But yeah, so no warranty. However, we do stand by our infection rates and quality care. And our quality care is just as great as everyone else around here. Everyone thinks, oh, well, if it's cash pay, they're not following the same rules. That's actually not true. We went through the same licensing and accreditation that everyone else has gone through. And our quality care is high.
So,
and Mandy.
Yeah, go ahead, Travis.
I was going to say, I've been in their operating room.
Oh, wow. They didn't
Yeah,
let you
so I
operate, did you? I
actually
mean, you're a
left-
smooth operator,
Yeah.
Travis, but I don't want you operating on me.
No, you don't, because I had to have a chair ready just in case I passed out.
Oh,
But
yeah.
I for sure was in that room, witnessed the most top-notch surgeons and support team do that procedure, and I can say confidently that we would refer our patients to them. Lisa runs a tight ship, and they do amazing care there.
A lot of people are asking how to get a hold of Pinnacle or the Smith Medical Center. I put them both on the blog, but Pinnacle is pinnacleapc.com. And I have probably 15 super specific questions that you guys need to call and talk to Travis about, because they're so highly specific that I don't want to kind of get into the weeds on the radio, but just go to Pinnacle APC. That's Pinnacle Advanced Primary Care, pinnacleapc.com. And then Lisa can be found at smithdirectcare.com. And if you're anything like me, you're going to go to the website and look how much every surgery costs. That's what I did yesterday, Lisa. So now I know how much every single surgery at Smith Direct Care is going to cost should I need to use your services. Guys, I love what you're doing so much, Lisa. I'm so glad you guys brought this to Colorado.
Oh, absolutely. And it's really fun to be a part of it.
Does somebody just asked, what about physical therapy services after surgery?
So we do have physical therapists that we work with that can be a cash pay price, or many times they'll use their insurance, because it doesn't mean, a lot of times when people are going direct or employers are going direct, it doesn't mean that they don't carry an insurance. It just means that they're putting them in a tighter box.
Right.
And so they can use their insurance afterwards, after the surgery.
I do have probably 10 questions of this nature. Would I benefit if I have Medicare? Travis, how do you do with Medicare patients?
So with Medicare patients, they do have to sign an opt-out waiver from a DPC standpoint, right? You cannot bill our services back to those government programs, right? But we know there are gaps in that care. We know there are gaps in payment, so we can actually help bridge that. And then, too, as people age, they need more than a 7.5 visit. So we actually find those folks are actually contracting with the DPC and using direct pay resources, even if they're using some of those programs.
So what about somebody asked, please ask your guest what the monthly cost would compare to Blue Cross Blue Shield. We're a family of 4 and pay out the nose. Travis, your prices, you can just give those for a family. What do they look like?
So I would highly recommend that if you are a family that's relatively healthy, low utilizer of healthcare, I would recommend a combination of direct primary care and Zion Health Share. We can get a family premium to around $600 for the entire household, with roughly $3,000 out of pocket, and plus you'll add, $100 or so on top of that for your DPC membership. But we know families paying upwards of $1,700 a month with $15,000 deductibles. PinnacleAPC.com, SmithDirectCare.com. Lisa Fagan, Travis Bockenstedt, thank you so much for making time today, and just what a great thing to be happening in Colorado. I love it. Thanks, Mandy.
Thanks, Mandy.
Thanks, Lisa. And now look what the cat dragged it. Oh, you got the tiny chair.
Yeah.